Here we're in Chicago. Of course, people know me. I'm Dr. Yates, and everybody should know Julie Ponce because she's a professional musician who plays an upright bass. And people who know anything about music, when you play an upright bass, that is not easy. Like a lot of people.
And sing at the same time.
And she sings at the same time. I've heard her perform several times. I was so impressed. You know, you are such a talented individual.
Thank you
It's
so
my
much,
pleasure to know you. Now, the reason that I know Julie, not just because she plays so well and I like to hear her play, is that she came to see me about a year ago because she was a little concerned about her hairline. You know, she has nice red hair, she has very tiny features, and she wanted to be all she can be, like the Army says, right?
Right.
So, what we did a 1,500 grafts to the front here, and you can see, now I have her before picture right here, so I'm going to show you in a minute. But if you just look here, you would not know she had a hair transplant. It looks totally natural. You can comb it, you can do whatever you want. There's nothing in it. You can, look at my hand. I haven't sprayed the spray stuff that people use. We haven't put anything in this. This is her hair. Now, let's look at it before. Now, Julie, you look at this first and you tell me, is that you?
Oh my God. I didn't realize that I had so little hair up there. I'm so used to what you did, doctor. Oh my God, I hardly had any hair.
Well, this is the picture that we're showing, and it's showing the graft placement right after surgery. We always do pictures with graft placement after surgery because patients will come back sometime and they'll say, oh, you didn't put hair here, or you didn't do this, or you didn't do that. So we always, because the graft placement picture is the litmus test. It kind of tells us really what's going on. So you can see, I'm going to come here, how her face is framed. She has a tiny little face, tiny little forehead. Everything is framed beautifully here. The reason she's here today is because, like anything else, everybody wants more, as they should. She has good donor here. We're going to thicken this hairline up a little bit more, probably put some in this area here, just thicken the part since she wears her hair this way, just to give her better results. But what I want to let you know is that hair restoration works well for female patients. A lot of people have said in the past, it doesn't work, it doesn't look natural, you shouldn't do it. There's some tricks to it. Usually the donor, you have to have good donor or it's not going to work as well. But Julie, I think you've had a great result.
Yes, I honestly did. I didn't realize that I had absolutely no hair.
Yeah, it was fairly thin up there. And that's another thing. There's a word I like to use, it's a simple word called denial. That everybody, so many people are in denial and they have no clue. They can convince themselves in the mirror. And I used to be one of those people. Sometimes I look at pictures of how I used to look years ago before I had a hair transplant. And I would go out and I'd say, oh, I look good like this. It's totally denial. And one day you have to wake up and say, wave the white flag and say, I've done what I can do, meaning yourself. I've done all these products. Somebody else has to help, which means me. Which brings me to one more thing. We have a new product line, which we're going to start Julie on, which is based on science. Pumpkin seed oil, yucca root. Yucca root extract has been used by Native Americans for years. And I used to live in the Southwest, and I would always comment on how good everybody's hair looks. Nobody went bald, nobody has split ends, everybody's hair looked great. And they'd always say, Doc, we just use yucca root. That's all we use. Yucca, some people call it yakka, but I think it's yucca. So we created a product line based around that with pumpkin seed extract, which blocks DHT. So we have two different shampoos because you need to rotate shampoos. Your hair gets used to one thing.
Yes.
So we have two different shampoos, two different conditioners. We have everything you need, and we have something called argan oil. And a lot of people call it argan oil. Rob, have you heard of argan oil? You've heard of argan oil.
Yes, I have. I use it underneath my eyes.
Right, and the way it's spelled with an A, not with an O. If you say argan, argan is a gas, okay? It's on the periodic chart because a lot of people, when I go into beauty salons, I'll talk about argan oil, and they don't know what I'm talking about. There's no such thing as argan oil. Argan is a gas. So we have argan oil, which is a finishing oil that we use. It also has green tea extract, it has vitamin E, it has olive oil. All these things are used to prevent breakage, and you just need a little smidgen on your hair. It's kind of the final thing. So I want everyone to try it because I do think some shampoos and conditioners do make a difference. hair transplantation in female patient definitely works. 1, if you choose the right patient. 2, if you know what you're doing. And here, that goes without saying. Julie, would you agree?
I absolutely agree, and I also think that having the right surgeon is very, very important. Somebody that is adept at what they do, they're knowledgeable, they're up on the new techniques, and that person is you, Dr. Yates. And I really thank you. It was excellent, excellently done, and I can't wait for my next transplant.
I know. You keep getting prettier and prettier. I mean,
Thank you.
how much prettier can you get? So this is Dr. Yates. We'll see you next time. Thanks.